Hi everyone, I'm back, and yes, I'm still in my car because I'm on my lunch break and this is my only solitude. At home I have none unless everybody is asleep, meaning my boyfriend and his 5-year-old daughter that we have, and this is my solitude time. But anyway, I just like to describe more about the pituitary adenoma, treatment, symptoms, that kind of stuff. And I have all my notes here, so that's why I keep looking down and around, because I know people are probably walking by looking at me like, who is she talking to? But anyway, I'm talking to my friends, even though I don't have any yet because I just started this channel. But hopefully by the time you see it, I have more friends or followers or subscribers, whatever. So a pituitary adenoma, there's actually a few different kinds. The kind that I have that affects fertility is called a prolactin secreting pituitary adenoma, or a prolactinoma. So I'm going to go over the symptoms, treatments, and how it affects pregnancy. So like I said, it's a tumor on your pituitary gland that secretes too much prolactin, which is what your body makes when you're pregnant, which makes you produce milk, not have a period, and stuff like that. It's right behind your eyes on your pituitary gland. It's either considered macro or micro depending on the size. And a regular person, once they get pregnant, their body's going to start producing more prolactin, which is how they start developing breast milk so they can nurse. And then once you stop nursing, your prolactin starts to decrease and you stop making milk and you get your periods back. A normal prolactin level is between 4 and 24.4. At least that's what it says on the paperwork my doctor gave me, as far as like what my levels were and what the normal level was. Symptoms of a pituitary adenoma are headaches, nausea, no period or irregular periods, a loss of vision or peripheral vision. As it starts to grow, it can press on your optical nerves, and that's what causes tunnel vision, or loss of peripheral vision. Weight gain, weight loss, breast milk when you're not pregnant or haven't had any kids. Muscle weakness or tiredness, infertility, obviously, lack of sex drive. In men, it can cause erectile dysfunction. There's no known specific causes of it. It just happens, I guess. In my specific case, I think it was caused by the Depo shot. I was on Depo from age 15 to about age 19 or 20, and once I stopped taking Depo, 2 years later I still didn't have a period. But luckily the doctor I had at the time, she had the same issue, so she knew exactly what it was from the symptoms I was having. But I'll get more into that when I do the video about my story, I guess. Medications that are prescribed for it are Bromocriptine and Cabergoline. Bromocriptine, my original doctor, she asked me if I was trying to have a baby then, and I told her no, because I was in a situation where I did not want to have a baby with the person I was with. But I did want to start taking care of the issue. So she told me if I was to take Bromocriptine, it could take up to 5 years for me to be able to have a baby. Bromocriptine had really bad side effects. I had to take it twice a day, and I'm not a person who remembers everything. And even though I was supposed to take this every day, twice a day, I would always forget to take it. So it didn't really work out well. The other medication, Cabergoline, you take twice a week, and you start off on a half a pill. That's what I'm taking now because I want to conceive now. So they start you off on a low dose, a half a pill twice a week, and then depending on how your levels are going down, or I have hit a plateau twice now, so mine's been increased. Just yesterday, I was increased to a pill and a half. And before that, I was just taking one pill twice a day, but I started off on a half a pill twice a day. That one has the same, pretty much same side effects as bromocriptine, but I did a lot of research before I started going back to the doctor, and everyone said to take it before bed, so that's what I did, and haven't had any side effects at all, and it's been working great. Way better than the bromocriptine did for me anyway, but that may be because I really want to have a baby now. The side effects of the pills could be dizziness, sleepiness, feeling faint, nauseous. But like I said, if you take it before bed, you rarely feel any of the side effects. At least in my case, I didn't. If you miss your dosage, your levels can rise quickly. So I suggest taking it the day you're supposed to take it. My first doctor, the one who had the pituitary adenoma, she would have me come in to get my blood drawn every month. So I'm pretty much a stickler on that. My doctor, she stopped seeing me every month, and then now she's only going to see me every 3 months since it's gotten down so low. And she wasn't going to have me take my blood until I came back in, and I told her no, I need my blood drawn every 30 days until I am within that range, under 24, the lowest possible. So I really suggest having it taken monthly or every 2 months, but I push my doctor to do what I want her to do because I'm 32. I don't have that much time. Let's see. The other options to get rid of the tumor are surgery, which is done through your nose. I don't want to say it wrong. It's called transfenodermal or something like that. Or radiation, but I haven't heard of many people opting for radiation, obviously. As far as how it affects pregnancy, it's pretty self-explanatory. Your body already thinks it's pregnant. You're making milk and you don't have periods. You can't ovulate if you don't have a period. So it basically tricks your body into thinking that it's already pregnant. Yeah, so I mean that's pretty much all the research that I've come across on it. There may be more. It's different for everybody. But soon I'll post a video. Probably now. I still have about 30 minutes on my lunch break. About, how it's affected me and my story with having the pituitary adenoma. So thank you for listening. I hope I could help someone else who has the issue. And then if you have any information that you can give me, definitely leave it. And just thank you for listening, and I wish baby dust to everyone. Thank you.